my name is Marc Milia and I appreciate you watching this video. I'd like to try and help you learn how to use your sling a little bit better so that when you get home from the hospital you know how to deal with it. The first thing I would say is if you take your sling off and just kind of look at it, there's a bunch of straps. Each strap on the shoulder harness has Velcro that can make it tighter for you. Once you get to know your straps, you'll be able to adjust it better. There's a strap that actually goes across the arm portion and then around the thumb. And then if you look at the ball that's there, it's right next to a waist strap, and that strap can be adjusted both in the back right there or in the front. Now the advantage of knowing that is that it'll help you take your sling off. So when you remove your sling, it's best to be sitting down either on a bed or a sofa. Once again, I'm just showing here that the strap should be so that your neck is comfortable, but first you just take the sling off by unclicking these two buttons that are by the wrist and then swinging the shoulder strap around next to you, and then you unclick the one that's by your waist. Once you take the one by your waist off, you can then remove the strap that's across the top of your forearm and then by your thumb, and then just slide the sling out from underneath your arm. And you can see in this video I'm not moving my arm very much. Now in order to get the shoulder moving without hurting anything, especially if you've had a rotator cuff repair, you just let your arm hang. Maybe move it 5 or 6 inches in each direction. You are allowed to bend your elbow or even raise your shoulders, but I don't want you to raise your arm away from your body. That way it'll protect whatever's been repaired in your shoulder. Now getting dressed is a little bit trickier. When you get dressed, it's best to be sitting down. I always put the surgical arm in first, so you don't have to move the arm around, and you reach around behind you to put the shirt on. It's best to use button downs for the first week or so until you get situated. Now putting the sling on is essentially the same as taking it off, just in reverse, and so you just make sure all the attachments have been loosened up. So I've unclicked the clips at the front, I've undone the thumb strap and the forearm strap, and I've put the waist strap behind me. That way you can just set the sling underneath your arm without moving your shoulder much. And then the next thing you want to do is attach the forearm strap so it keeps your elbow back. You then reach behind you to grab the waist strap and click it on the front, and then you bring the strap over around your neck and attach it to the clips on the front by your wrist. You can certainly do the adjust the strap around your neck so that that pad is closer to your neck and doesn't hurt. And then finally the thumb is attached. Now if you have any questions, there's the email to my assistant, there's our phone number, and our email to the scheduling department. I'd like to make this as simple as possible for you. Thanks for watching. Okay, back to the presentation here. So let's talk about after the procedure and what to do with your incisions. Now I'm going to show you a picture on the next page here that explains what you're going to see when you come out of the surgical facility. But it's important for the first 24 hours, no matter what's on there, just to leave it on and leave the dressing clean. The dressing can be removed about a day after surgery, and then you can handle taking a shower and whatnot, but I'll explain that in a second. The pain catheter that's in your neck doesn't need to be removed until the 3rd day, and you'll receive instructions from the anesthesia staff, and we'll talk about that as well. So when you leave the facility, you're either going to have a big white pad on your shoulder or you're going to have these plastic sticky things. Now the big white pad is obviously pretty cumbersome, so you're going to want to take that off sooner than later. I would recommend taking it off 24 hours later like we explained, and you will see either steri strips like this or you'll see incisions like this. Now if you have this on your shoulder, you can actually leave that on for a week if you want to, because it's all waterproof. But if you get tired of looking at it, you can take it off the day after the procedure as well, and you'll see something like this, which is just steri strips. Steri strips, you just leave those alone. You don't need to put band-aids over them. But if you have incisions with sutures sticking out, I'd like you to put band-aids on them every day for 2 weeks. The steri strips, you peel those off by the 14th day. And as I mentioned, it's okay to take a shower as soon as the catheter is removed, which is the 3rd day. And we're going to talk about that in a second. For the Band-Aids that are over the incisions that have sutures in them, I want you to do that for 2 weeks. And really it's just because the sutures can bother be bothered by clothing, so it's better to just keep them covered. And when you're in the shower, you can let your arm hang down. You can even do that little pendulum exercise that we just discussed. Now, when you leave the facility, you're going to have this catheter in your neck, and it's going to be completely covered by this clear plastic Tegaderm dressing. After the 3rd day, you can remove it. All you do is you peel the dressing off, and you just basically pull the catheter straight out. And when you take it out, it doesn't bleed. There's a little black tip at the end of the catheter, and you just put a Band-Aid over the incision, or over the little hole that was there. You don't need to worry about it bleeding. It's very unlikely to get infected, but if you have any concerns, once again, you can always send me a picture actually through the app Get Well Loop. Now, just in terms of daily activities, really you should be wearing your sling around the house for that first month until we meet in the office. I tailor the sling usage a little bit for every patient differently based on what I see at the time of the procedure, and I'll explain it to you at that first visit. Now, you really shouldn't operate a vehicle while you're in your sling, especially if you're using pain medication. And once again, for the first couple weeks, I would recommend not doing it, and then we can discuss it at the office. There's certain scenarios where I would be okay with it after a couple weeks. Now, returning to work depends on a number of factors. Some patients have the ability to work with one hand and sit in an office and make phone calls. But if you have to drive to work, you may want to wait until you see me in the office for that. Now, once again, we discussed the constipating aspects of pain medicine. So when you eat, the first few meals should be light. You should drink plenty of fluids. You may want to add some type of a fiber supplement, and definitely take some Colace, which is a stool softener. You can take Colace twice a day, and as I mentioned, I would recommend starting even before the procedure so that you don't get behind on that. Now, there are some things that rarely occur, but it should be important that you know what they are. If you see a lot of redness around your incisions, or if blood is draining for more than a day or two, you're going to want to let us know. It's normal to have some leakage for the first day, but you shouldn't have any more after that. So sometimes the dressings will be a little bit wet, and you just remove them and put the Band-Aids on. Things will dry up. If you have a temperature over 101 without an apparent cause, then you definitely want to let us know. If you're having pain, swelling, or redness in your forearm or your hand, it's important to let us know. Now, numbness or weakness in the arm or hand is normal after the block for 3 days. However, if the block has been removed and you're still having that even more than 6 hours later, you're going to want to let me know. These are all very rare problems that I don't hardly ever hear about because it's just not common. And so I don't want you to be concerned about it, but I just want you to know what to do. Now, if it's after hours, you can call the phone number 313-396-0547. But during the day, it's a lot easier to get a hold of me by calling my assistant at extension 309. And once again, if you're the kind of person who doesn't like to deal with phone calls, you can certainly send me an email at Milia, MA@mosortho.com. We usually get to those within 24 hours. So if it's something you're really concerned about, try calling us first. You're going to want to see me in the office or one of my physician assistants within a week or two. Hopefully you've already had that visit scheduled before you even had the procedure, but if you haven't, once again, you can email us at miliasketch@mosortho.com, and that goes for anybody. If anybody needs to see me that you know and they don't want to make phone calls, this email goes directly to our schedulers. And finally, the phone number for my scheduler is extension 309 at our main office. And once again, just to emphasize, if you have any questions about anything during the day, call us at our main office number, 313-277-6700, and then just put in extension 309. And you can tell my assistant that you have a question for me, and if it's super urgent, she'll get me, and we can discuss it on the phone. If it's something that can wait, she'll give me a message, and we will call you back. You can also email me at miliama@mosortho.com. If you feel like you have not gotten in touch with me in the time frame during the day, you can call after hours at 313-396-0547. the answering service can track me down. Hopefully this information will be helpful for you in your recovery process, and that you understand that I'm doing everything I can to make the process easier for you and me more accessible to you. Thank you so much for your attention.